Hello, everyone. My name is Matthew Williams, and I am the Nutrition and Food Service Coordinator here in the Division of Chronic Disease and Injury Prevention within the Philadelphia Department of Public Health. I will share some tips and strategies for how small changes can add up to big rewards in improving outcomes to reduce the risk of developing chronic conditions by focusing on nutrition. We know that nutrition is an essential piece of health and well-being for all people. Here in the Division of Chronic Disease and Injury Prevention, we believe all people have the right to live to their fullest potential in environments that allow them to grow and thrive. We aim to make healthy choices easier where people live, work, learn, shop, worship, and play. We focus on food justice, physical activity, tobacco control, and violence reduction. The objective of today's e-module will be that participants will be able to identify strategies that promote healthy eating nutrition to help support families in their daily lives by focusing on small changes and how they lead to big rewards. Why is this e-module relevant to staff who serve families with young children? We know that nutrition is a key part of health and wellness for the entire family. Understanding how to support families with information to make healthier nutrition choices in their lives can help promote healthier lifestyles as well as prevent chronic diseases. Let's start by examining some of the challenges. Philadelphia is the sixth largest city in the nation and yet is also the poorest city in the United States. Philadelphia's rates of hypertension, diabetes, and heart disease are some of the highest in the nation. What we look to do is really improve the access to delicious, nutritious, culturally relevant, affordable food that can support physical, mental, and emotional well-being of every person in Philadelphia. Small changes and big rewards, and the importance of nutrition. We want to support families in finding the ways to improve their nutrition that fits in not only culturally, but also good eating habits as a way to minimize and reduce the risk of developing chronic conditions. And again, we're going to do this by making those small changes that will add up to big rewards. Let's start off by looking at one of my favorites, eat the rainbow. And what I mean by when I say eat the rainbow is let's find different ways to incorporate fruits and vegetables into meals and snacks. Each color of fruit and vegetable represents a different health benefit. For example, carrots represent vitamin A, and then oranges for vitamin C. Fresh versus frozen. When purchasing fresh fruits and vegetables, look to buy in-season fresh produce, which will be cheaper than out-of-season produce, which will cost more. Frozen vegetables can be utilized year-round and are a good alternative to fresh produce. Just be careful to check the label for those that have added sodium. Try to avoid frozen vegetables that are in sauce as they add extra sugar, salt, and calories. If utilizing canned fruits, pick those that are in water or 100% fruit juice and not in syrup. When selecting canned vegetables, look for those that say either low sodium or no salt added. Focus on fruits and vegetables. Fruits are naturally sweet and provide your body many health benefits. Eat a variety of different colored fruits and vegetables. Each color is associated with a different health benefit. Let's take a look at shopping and where to focus your attention. If you look on this diagram here, you'll see that on the outside aisles is where you'll find mostly a lot of your fresh things. So you have your fresh fruits and veggies, as well as your meat, poultry, and seafood. While if you look at the center of this diagram, the center aisles are where you'll find a lot of your highly processed and ultra processed items that contain a lot of extra sodium. One pro tip is to take stock of what you already have and make a shopping list to shop with. Shopping tips. Don't go shopping when you're hungry. Often shopping when hungry will lead you to make choices that are not based on nutritional content, but cravings you're having at the moment. One thing I like to stress is always make a shopping list. This will help to ensure you only buy the items you need and stay within your budget. Less salt. So why less salt? Consuming too much sodium can increase your blood pressure and your risk for heart disease and stroke. On average, Americans consume more than 3,400 milligrams of sodium per day, which is above the recommended limit of 2,300 milligrams. Reducing your sodium intake can help lower your blood pressure and improve the health of your heart. On this slide, you will find a few tips that allow you to do that. For example, drain and rinsing canned vegetables and beans will help to reduce the amount of sodium. Why less sugar? 1.5 million Americans are diagnosed with diabetes every year. The CDC estimates that if current trends continue, 40% of Americans and more than 50% of African Americans and Latinos will develop diabetes in their lifetimes. This slide gives a couple of tips and tricks that you can do to reduce the sugar. For example, like eating plain yogurt and adding in dried or fresh fruit and cinnamon. Why more fiber? Fiber is healthy for the digestive system. High fiber foods are good sources of nutrients and vitamins that may help to reduce the risk of heart disease and certain types of cancers and obesity. On this slide, you will find different things that you can try. For an example, adding beans or lentils to your next meal. Why more water? Water not only helps keep you hydrated, but it's also the best option because it is sugar and calorie free, unlike many sugar sweetened beverages. Water also helps to regulate your body temperature. Here we are. I would like to go over a couple of snack tips. 1. Make it a habit to choose a variety of healthy foods for your snacks. Prep grab bags for an on-the-go snacking experience. You can use fresh fruit, veggies, or nuts. Another favorite is to mix and match. Combine two of your favorites. For example, pair yogurt and berries or apples with nut butter. Stay hydrated by drinking water. If you can, carry a water bottle with you. When thinking about promoting nutrition within communities, we need to really truly think about working with communities to understand what are some of the barriers that stand in the way and prevent folks from eating healthy. Let's take a look at these reflection questions that help us to look at the issue on a broader level. Barriers around nutrition cannot be placed solely on the individual, and we need to take a look at the way the environments and food systems are set up in order to truly begin to heal society through individual and community well-being. In order to do that, let's consider some of these questions. What affects the family's ability to access healthy and nutritious foods? And how does this impact the people and families you work with? The following is a list of Philadelphia nutrition resources. First up is the PA WIC, which provides nutrition services, breastfeeding support, healthcare and social service referrals, along with healthy foods. Next is SNAP, which provides eligible individuals and families with assistance to purchase healthy foods. My Plate helps people to learn about choosing a variety of healthy foods within all the food groups. The Philadelphia Food Finder is open to any Philadelphia resident. No ID or proof of income is required. Here you can search by address for free food and meal sites, including student meals, which include school breaks in summer, as well as older adult meal sites. Before you go, please call the site for hours just to double check to make sure they're open. The next resource is the Philadelphia Farmers Market Finder, which allows you to search by address for the nearest farmers market near you. You can find dates, hours, payment options, and more for each farmers market. You can also filter to find markets that are accepting SNAP, the Farmers Market Nutrition Program, as well as Senior and Philly Food Bucks. The next resource is the Food Trust Nutrition Navigator. The Food Trust Nutrition Navigator is a tool where you can search by address to find food and resources in your area by your specific zip code. And last but not least is the Philadelphia Sodium Warning Label Law. The Sodium Warning Label Law went into effect on September 12, 2018, and it requires all chain restaurants in Philadelphia with 15 or more locations nationwide to include a sodium warning label on high sodium menu items on their menus that have 2,300 milligrams of sodium or more. The sodium warning label gives diners information they need to make healthier choices when they eat out. The sodium warning label educates and alerts diners about items with very high levels of sodium on menus and allows residents to choose lower sodium menu items. Let's be social. Connect with us through social media and show us what gets you moving and what you're eating. Thank you for watching this e-module. For questions about the content of this e-module, you can contact me directly at matthew.williams@phila.gov. Please share your feedback to help us improve this e-module and to receive a completion certificate. Thanks again, and thanks for watching.